So thank you, Anne Marie. Yes. So as everyone can see, we've got a little QR code or a link that you can use to get yourself signed into this meeting. I'll show that link in. So we're going to jump right into it. Morgan, if we can go ahead. We're going to do quick welcome and introductions, some network development updates. I'm going to do an overview of the network structure just to bring everybody onto the same page. We're also going to do some program updates, do some partner sharing, a quick review of the call to action that's been out, kind of a standing item on these agendas, and then we'll look at the date for the next meeting. So thank you everyone for being here. I apologize. It looks like I'm going to be bumped in and out of this meeting. And so as quickly as possible, I'm going to try to get this turned over to the other people on the agenda. I do want to start with welcome and introductions though. Morgan, if you can just go to the next slide. Introduce two new members of the Heart Network team. Here today, we have Meg Carter. I believe she should be here. And we also have Amy Kohansky. Meg is doing, and you'll hear from both of them, well, at least Meg later in the meeting. Meg is doing a lot of outreach. And Amy is here replacing the work that Luann Villani was doing with practice engagement. Are there any other introductions that we need to make before we jump into the agenda? Any new people? Other new people at the meeting today?
And this is Dana. I think this is the first time in a long time, if ever, that I've been on this meeting. So just to let you know, I'm here. Happy to be here.
Here, Dana. Thank you. Okay, so I'm going to move right along to network development updates. We're actually going to go forward to the next slide, Morgan, and I'd like to turn it over to Kate Pabst to have her share her screen and take us on a walkthrough of the data dashboard that the data team has been working.
Hello, I'm actually here with Laura Morris, so she's going to pull up her screen.
I can't share. Screen sharing is disabled. Can somebody activate me for that?
I will do that right now.
Thank you.
And I would like to apologize in advance if there's a little background noise. We are in a conference room, and right outside there is a utility truck that's making a lot of noise. So if you have any problems hearing, please let us know.
Let's see. Can everybody see a screen that says AHI? It has some pictures at the top.
Yes.
Yes.
Okay.
Yeah.
So, and I'll just jump in real quick, just so this is the AHI reporting portal. As you can see, it's a web-based reporting portal that AHI supports, with the ACO. And we're starting to move all of our reporting, it's all Power BI based, into this environment so that it's easy for stakeholders and partners to access reports that are interactive. It's easy for us to update. So these chronic disease self-management dashboards that Kate's going to show right now, we have this in our external partner view. I'll, after the meeting, email this group so that anybody who wants access to these two reports can, to these two reports, can log into the reporting portal. We'll get you an account and you can go look at these yourself. So that's just so you know what the environment is.
Okay. And I think in the future, probably we're going to be like combining these two dashboards into one. just for the time being there in 2. I know we have a really full agenda today, so I'm not sure we'll have time to get really into the weeds, into the dashboard. But I just wanted to let you know that if you have any questions, any follow-up, any suggestions, we're always available, like offline, to meet one-on-one, and talk through anything that interests you. So here is an example of our dashboard. How do
Hide
you
that
hide?
first, and then click
Back.
here. Full screen. Yeah, full screen. We'll see the tabs.
All right. So here's a quick navigation page. And what we're sort of interested in on this dashboard is sort of just like an overview of the health of our population in this area. So as you can see, we have a number of health conditions, and we're interested in not just the prevalence, but also the count. So, for example, a smaller rural community might have a very high prevalence of a certain disease, but because there's so few people there, like the actual number of people affected isn't that great. And then we also have some data that talks to the program utilization. So I'm just going to go to diabetes port control. And what you can see in the top left corner is just a brief description of what you're looking at. So this should give like the metric specification, what exactly do we mean by diabetes port control or whatever condition. And then the charts correspond to counties in our area, so Clinton, Essex, Franklin, and so on. The dark green is that particular county, and then the light green with the they're not green, they're blue. The light dashed blue is like all the counties. So you can kind of see like a comparison of how that area is doing in relation to others.
And just
go ahead.
This data is coming from Hicksney Population Health dashboard that they generate, they gave us access to. So previously, Kate's run tables out. So this is, you may be familiar with the tables we've looked at other years. We've just taken this out and put it into a visual form. So if you're wondering what the source of this is, it's Hicksney.
The count looks very similar. So this is hypertension, for example. And then the program utilization, this data is a little old. We do need to refresh it a little bit, but you can see, how many programs we started, how many started versus what our target was, some information about the enrollment, and some information about the referrals. One other thing that, how do I get out of full screen? Like that?
Yep.
Can you get us back to the pre-post?
Go here. And then, scroll. And there's like a little scroll bar over here somewhere.
Oh, there we go. One thing we're also interested in, obviously, not just program utilization, but also, like what are some of the outcomes of people who go through these programs. And so again, this data is a little bit more updated. I did not include the latest batch from, I think, early this week. But this has information from the respondents about basically like their state of health before and after the program. So they are answering these questions about, like, do you feel like you're in control of your health? Can you manage your condition? Do you make more healthy lifestyle changes? And we're kind of interested in seeing like how many people like increased or decreased their score on these questions pre and post intervention, the intervention being the workshop. So you can see sort of just like visual representation of how people are changing in regards to their self-reported outcomes. We don't have any clinical outcomes in here. This is more like self-reported. So they say that they're exercising more or something like that.
And we will be working on bringing clinical outcomes into it. We're just now kind of starting to get maybe enough people to be able to start building some mock outcome reports.
So hopefully to come clinical, but for now, this is what we have. And, you know, I know we have a full agenda, so I don't want to take up too much of the time, but I do want to invite you to look at it and definitely contact us with any suggestions, concerns, anything like that.
Hi, this is Michelle. I just have a quick question. Like, where does, like, I'm not really familiar with Hicksney. I kind of know what it is, but I'm not really smart up on it. So where does the data, like, how does the data get into Hicksney? Who puts it there?
Right. So the Hicksney data for the population health, so Hicksney is connected to, you know, I would say the majority of the providers in our region. The health information exchanges, just as kind of a refresher, we have, I think, 5 or 6 across the state. So Hicksney is our regional health information exchange. All of the providers who submit data to Hicksney, Hicksney then creates these reports using all of those clinical encounters that they've received from the providers. So the EHR sends data to Hicksney, and then Hicksney generates that report for us. Does that answer your question?
Yeah, but I guess I'm like, I don't think Hicksney is very popular up here in St. Lawrence County. Am I wrong in saying that?
Right. So we do have a connection, and for those reports, I believe that it's Hicksney only. For some of our clinical data, Healthy Connections is connected into Hicksney, so we are getting some Healthy Connections data. I'd have to double check whether the population health data includes Healthy Connections. We do have a separate Healthy Connections access that we're just starting to consent individuals into, but that won't be for regional data like that population health data. So that's
okay. So I just was curious because the St. Lawrence looked really out of whack, and like it depends on where you're getting the data from, how many people are submitting it, and like I said, I don't think Hicksney is very popular up here like Healthy Connections. So I just want to point that out about the data.
No, that's a very fair point. Thank you for raising that, and I'll have to see what we can do to get some population health data to kind of fill that county in better a little for population health.
And Michelle, for your DPPs that are coming up as part of the packets that Ian maybe dropped off to you this morning, I think the Healthy Connections consent was part of that too.
Good. Well, this is great. I'm really excited to see this all starting to come together. I really want to thank Laura and Kate and the AHI team for, kind of, taking an idea and moving it into implementation. And so just a couple quick notes here that if anyone is interested in getting access to this information, any organization that we have an MOU with does have, can get access. So if you are interested, just send me an email. My email address is here. And I think, I'm also the owner of the meeting invite, so you can get my email there as well. We will send these slides out after the presentation. So thank you. Yep. And there will be, if you do request access, there is, sort of a little bit of a process. You have to, on our side, you end up having to create an account and we have to give you access. So just, it won't be sort of instantaneous, just to warn you, there will be a couple of steps as part of that. So just bear with us. Yeah. Yeah, so first step, get me an email so that I can verify that we have an MOU with your organization, and then we'll go from there. So just a couple quick things, Morgan, if I could ask you to, any other questions about the data dashboard and the work the data team's been doing? I don't see anything. So Morgan, if I could ask you to backspace and go back another one. There we go. I just want to quickly go through the other, Laura and Kate, I know you've got to get going, so thank you very much. They were at the bottom of this slide, so I'll just go back and pick up a couple other things from a network development perspective, a few things to just make sure everyone is aware of. We have been working since we received the Health Resources and Services Administration Network Development Grant, which does now allow us to reimburse organizations that are delivering programs. We've been working to get organizations into services agreements with us, which will allow us to, help those funds flow. We've also been, working on getting contracts in place with all of our other support organizations, including the Health Initiative and AHI. So that's been a big focus for the last couple of months. We have been also looking at we've identified one of our priority areas for this year from a development perspective is around the marketing and communications plan. You'll be seeing a lot more communications coming. Everyone should have gotten my my first attempt at an e-news. That's going to get a little bit more formal moving forward, and you'll start to definitely see more information coming and providing you with updates about what's happening network wide. And then in terms of marketing plan, we've got the bare bones of a plan that's in place, and really starting to move that into an implementation phase, planning for implementation phase. We've also been working to do a break-even analysis, so really starting to understand what it's costing to deliver these programs, and then comparing that to the revenues that we have coming in to pay for those programs, so that we can get a better handle on what we need to do to price these programs in order to keep us at break even and not losing money. And then we've been working with the Adirondack Wellness Connections, which is the Unitas platform, branded Unitas platform in our region. And we have been able to basically allow for receiving referrals to these programs through the Unitas platform and through Adirondack Wellness Connections for organizations that are using that platform. This does not take away from the referral form that we worked to develop. This is just another option for organizations, providers specifically, to be making referrals, again, if this is a platform that they're already using. And then lastly, from a network development perspective, just as an FYI, I think a lot of our delivery organizations are already aware that there are going to be some changes with Compass, which is the platform that we use to schedule and programs, to take enrollment for programs. It's where a lot of the participant data is collected and then transferred to AHI. So changes are going to be happening with that platform, which means we're going to be looking at, we've got use of that platform for another year. So we're going to be looking at, do we continue using that platform? Do we look at other options and solutions? But that'll be a big focus for us as we are moving into the next few months. So just an FYI. Any questions about any of that for the group? All right, so I moved network development. So Morgan, if you can advance now several slides, go to the next slide. I had intended to present this first, but we needed to get the AHI data dashboard presented first. So, but I did want to take a little step back to just put what is happening into some context for everyone. So I think everyone understands that the Heart Network is functioning as what we're calling the network lead entity for what we're now calling the Get Healthy North Country Network, or Community Integrated Health Network, formerly called the Coalition. And so the Heart Network's role, as network lead entity, is to lead strategy and, participate in a lot of the committee work that's happening. I wanted to kind of share with you, so you see in the center of the screen there, that's the Get Healthy North Country Network. The Heart Network does have a program function within the network under our practice engagement program strategy area. So that diabetes prevention, working with healthcare provider practices to engage them in projects to increase identification and treatment of, in this case, diabetes. It could be any chronic condition. That's a program area for the Heart Network. That's the only program, piece of the network that the Heart Network really has. We're more at the network level. So we have the Integrated Network Development Committee, which is the top circle in the center there. That is the committee that was established by the Heart Network's Board of Directors to provide members of the network meaningful input and into where this network is going from a development perspective. So the overall governance is technically through the Heart Network's Board of Directors, and then we've got multiple committees. If you go to the next slide, I'm rushing here because I think I'm going to get cut off. The next slide is just a drill in on the Get Healthy North Country. This is very overly simplified, but we've got the Integrated Network Development Committee again that's leading the strategy and advising the North Country Healthy Heart Network's Board of Directors and helping to make decisions from a governance perspective. The programs are a big piece of this. We're doing all of this to get the programs out there. And the circle bottom right on programs, it's not just about the diabetes prevention program and the chronic disease self-management programs. It's about all of the work that's happening to get those programs out there, to support the organizations that are delivering these programs, to market them, to make it easier for providers to make referrals. All of that falls into that program area. And then we've got multiple committees or work teams that are working to, again, guide a lot of the work that we're doing. So we've got the data team, which is responsible for the data dashboard that we just looked at. We've got a recruitment strategies team that you're going to hear about in just a few minutes. And we're just now forming a payer strategies team that is charged or will be charged with really helping us to understand what steps we need to take and strategies that we'll use to get healthcare payers engaged in contracts to help pay for the programs that all of our delivery organizations are providing. So I wanted to share this to just, again, give people some more context for all of the work that we're doing. And I'll just pause for a minute to see if anyone has any questions about that, any of that. Does it make sense?
Yes, this was helpful to understand. Thank you for providing it.
Yes, it was. Thank you.
Absolutely. Yay. I'm glad. Okay, so let's go next to, I'm going to turn it over to Anne Marie, and she's going to give us an update on what's been happening from the St. Lawrence County Health Initiative Leader Training and Technical Assistance Center perspective.
Thank you, Anne. Okay, you can go to the next slide for me, Morgan. So as you are aware, we have a number of delivery organizations across the North Country region. We are looking to increase our capacity to deliver. In particular, we've identified that it's not that we don't have enough peer leaders, it's just that in some areas we don't have peer leaders who are able to provide workshops during certain times of days or months. So what we're looking to do is to host a peer leader training. You may have seen an announcement come out that we were going to start one on next week, actually, in partnership with the Western New York Integrated Care Collaborative. And unfortunately, that workshop cannot happen. It has to do more so with the ability of the network to make that happen in such a short time frame and the participants' availability during those time frames. So what we are going to do is to explore here to try and do something starting in later October. So look for a new flyer to come out soon. It is ideal for us to have delivery organizations manage a volunteer workforce. So if you are not currently a delivery organization, but you do have a volunteer workforce already, and you think that that volunteer workforce may be interested in exploring what it looks like to deliver chronic disease self-management education, please reach out to me or to Julie or Jerome, and Ariana, we can put those in the chat after this. Specifically, we are looking for anywhere in the region, but it would be great to have peer leaders who can deliver in Franklin and Clinton counties. We're looking for individuals who have somewhat flexible scheduling, in particular evenings and weekends, and looking to see if we can't have at least some peer leaders in those areas who can deliver in the summer and fall months. Now, this training will not be exclusive to participants in Franklin and Clinton counties. We recognize that, there are a number of people outside of that area who are interested in becoming peer leaders. So once we do push this out, we will have an application for peer leaders, and we are going to certainly weigh who we are allowing to participate based on where they reside and their ability to meet our expectations. Are there any questions regarding peer leader increase and increasing our capacity to deliver? Next slide, please, Morgan. I want to share with you for year to date some enrollment data. You will see right now a large number of workshops on gethealthynoco.org. In fact, I have an image coming up shortly. What you see on this screen right here is not the number of workshops that have been scheduled, but the number of workshops that have been completed. So for chronic disease self-management program, we've had 7, 2 diabetes, 6 national diabetes prevention, 3 chronic pain self-management, and 1 cancer thriving and surviving. The number of participants per program are listed in the pie chart. Of course, with the more programs with CDSMP, that's where you have more participants. So we are eager to show you at the end of this year, with the large number of programs offered right now, a much different view of this bar graph. Next slide, please, Morgan. We do share here workshops by delivery organization. So the delivery organizations who have completed a workshop so far in 2023 are listed on the left, and the type of workshops that they've delivered are indicated by the colored bars. Oftentimes the health initiative, while we are listed as delivering quite a few, I want to highlight that many times we do have volunteer peer leaders under us who are supporting that work, who may be joining from either other delivery organizations or they are plain volunteers. So we're very grateful for our volunteer peer leader workforce. Next slide. So I want to share a little bit about the participant recruitment strategy team. Before I do that, are there any questions on enrollment or workshops delivered? Thank you, Ariana. Okay. So our participant recruitment strategy team is really looking to work on strategies that are outside of the provider referral strategy. You know, it would be ideal to have every provider in our region recognize the value of this and push their employees, refer their employees into the programs. But in addition to that, we recognize as well that the way that most of our participants get to us is through word of mouth or seeing a flyer or, something else. So that's what this strategy team is working on, trying to increase the number of participants who get to us, not just from their doctor. We look at data on how individuals are getting to these programs. This is self-reported data that I'll show in just a moment. We identify different strategies which would increase the online and public registrations and overall number of registrations. And we review delivery organization strategies for recruitment. I'll share a little bit about that as well. As you can see on the right, this pie chart shows that right now, year to date, the registration source, meaning how people are registering on Compass, the vast majority are Compass personnel. So it's an individual, either a peer leader or a delivery organization program coordinator who has the name of someone who is interested in this program and they are registering themselves. Or the online public means they're getting to us somehow through gethealthynoco.org. So whether that be New York Connects, it could be a provider referral, care coordinator referral, or the individual finds, sees a flyer, goes to the website and registers themselves. So we would like to see that online public, this team would like to see that online public slice of the pie increase. Next slide, please. So the self-reported referral sources, the vast majority of the individuals self-report that they somehow get to us through a healthcare provider. Now, when it says referrals, that could mean that they see a flyer in the office, in the waiting room, inside of the bathroom door, or the care coordinator mentions it to them, or the provider does refer them. Additionally, the second way is through word of mouth. So we recognize that there is a strong value in asking our participants to share about the programs with those they love. Following that, we do have traditional media, we have flyers, referral cards. The other option, oftentimes individuals are writing down in there either the name of their diabetes educator or stating New York Connects. So they could be repeating, not seeing the option and then just repeating. But many of those other places could slide into these other categories. Next slide.
And Marie, I have a question about that, if you don't mind.
No, not at all.
Where does the information sessions fit in that? Is that a community venue, or if someone signed up through an info session?
We do not currently have an information session option on Compass, and that's a really good question. Because these are,
I think it could probably fit under the community venue, maybe.
Yeah,
I have to create another one.
I agree.
Thank you.
Yep, absolutely. But it is something that I want to take a note of, just to see if we might be able to find a way for people to choose that in particular. I will say that no one who's written in other has said through a participant information session or at this location where one was held. Yeah. So far, this team has identified several different strategies for this recruitment. There are flyers that are printed. Very soon you will be able to see in Compass, or I should say in Compass, in gethealthynoco.org, when you click on a session and it shows the information about that, you will see soon that every one of those classes will also have a link to the flyer. So an organization who is going to gethealthynoco.org, if they're particularly interested in a session, if they go in for more information, they will be able to print those flyers on their own. Anne has just started a monthly newsletter. The information, there will be reminders about these upcoming opportunities linked in there in some way, shape, or form. We have been working toward emailing past participants about upcoming programs. Our most recent bulk email regarding that was not trackable to see if it resulted in any success. So we are going to change the way that we are emailing individuals so we can see how many click through to the registration page at a minimum. social media promotion, and finally, well, the two that are starred here are things that we are discussing and we are exploring, but we have not put into action yet. One is celebratory activism, and this is something that one of our most recent team members mentioned as a way to train people to bring this up at venues that are not necessarily meant to be promoting this. So if you are at an outdoor barbecue and, you have the opportunity to share about these programs in some way, shape, or form, that'd be great if you did that. We're not asking anyone to become salesmen and hound their families and friends to participate in this, but sometimes you might hear when someone says, I struggle with knee pain. Is there a way that we can help encourage our partners to share about alternative ways that they can get support for their chronic illnesses? And the next is training our participants to become our best recruiters. So we are exploring how we might be able to set up a system by which we can encourage participants after they complete their workshops more strongly to share about this program and what they got out of it. So we're exploring these. They are not yet put into action. And finally, the last item that I have on here is really a great segue to Meg Carter. I believe that she will be next. Anne, is that a yes? Yeah. Okay. So participant information sessions was an idea that was actually born out of a previous participant. And she said, I live in this housing complex and I know my other neighbors would be great for this. This is exactly what they need. We just need to tell them about it. And she said, just come, bring food, and people will come. So Amy Kohansky and Kathy got together and they pulled this participant information session off. And it resulted in, I think, 7 enrollments, I believe, somewhere around there, directly from that session. So Meg and the Heart Network team have really been working toward trying to replicate this throughout the North Country. So I'm going to turn it right over to Meg to share a little bit about participant information sessions. Does anyone have any questions before she starts?
I just have a quick question, and it's something I can follow up in an email as well. But your first slide about the peer, recruitment of peer leaders, just remind me, are there any requirements for someone to be able to fill that role? No education requirements regarding that, Carissa. These programs were actually designed for people with lived experience. It would be great to have individuals who do have a chronic illness or who have been caregivers for others with chronic illnesses. It is not a requirement. We do not require people to have letters behind their names. We do want people who don't mind speaking in front of 10 to 20 people, who would be able to follow a scripted evidence-based program. For instance, sometimes our nurses, RNs, may not always be the best people to deliver this. We do have some very great RNs who deliver the program, but when a participant says, I have this need, or this came up, or I don't know if my pills are interacting with one another, our peer leaders do need to be able to stop and say, that's a great question for your provider, and provide the tools necessary for that individual to reach out or find a primary care provider, rather than wanting to answer directly. You really shouldn't be taking that medication with this other medication. We shouldn't be doing that. Does that answer your question, Carissa? Yes, thank you.
You're welcome. Okay. Great. Thank you, everyone.
Thank you, Anne Marie. I put together a few of my own talking points. So Amy, at any point, if there's anything I don't cover, always feel free after to jump in, since you are the one that kind of got this off the ground. But Again, this is my first time on this meeting, so I want to introduce myself. I am Meg Carter, and I am the Community Outreach and Engagement Coordinator for the Chronic Disease Self-Management Program. So I just wanted to provide a few updates on kind of like our current outreach approach, starting with informational sessions. So for our virtual and in-person chronic disease workshops, we look to conduct informational sessions. These can be formal or informal. So in the past, we've done like a presentation, or we can do some tabling, really whatever works for the site that is hosting the informational session. Trying to spread words for the upcoming workshops, and kind of getting participants potentially interested in signing up. So we look at the data. So from there, we really look at the data to tell us which areas have the highest prevalence of chronic disease is occurring. So this same approach is also used for our workshops. We are beginning to try and host informational sessions for virtual programs to ramp up participation as well. So previously it was kind of just we were more concentrating on the ramping up of the in-person. So now we really are focusing too on the virtual programs. So right now, a county we are looking into to host informational sessions at is Franklin County, more specifically the Malone area. So we are looking to find sites to host informational sessions at, while also trying to recruit participants for a few upcoming virtual workshops, utilizing our outreach materials such as rack cards, flyers, posters, anything we can bring to like local organizations in the area and places around town. So once an informational session is conducted, we look for hosts for our workshops, sites in the area that will go along with where we conducted the informational session. This will have assisted us engaging. So the informational session will have assisted us in engaging kind of interest in the upcoming workshops. So we really strive to get like that participation. So that way we know what area we can focus on, and we can already kind of take the people that were interested in the workshops at the informational session, and we kind of can bring them over to the workshop. So that's really the point of the informational sessions. So we can either host at the same site that we conducted the informational session, or it can be a different site. So it's really flexible in that way, and I love that. So we are in the process of planning workshops 3 months ahead. In addition to, so that way we are ahead and are planning to, there's always something, I guess, on the Get Healthy North Country site. So something that something that someone can go to and can be like, okay, I'm really interested in this. And they're able to kind of just click on it right then and there and sign up. So that way there isn't a delay. So we really want the workshops in there like potentially 3 months ahead. So this is kind of really how we are planning our outreach and looking to ramp up participation in the upcoming workshops. And all the workshops are listed at the Get Healthy NoCo site, which I'm sure everyone's familiar with. If not, I can always post a link in the chat. But right now, we are looking to plan workshops in Franklin County, possibly starting at the beginning of the new year, as there is a high rate for chronic disease in this area. So that's kind of, we look to the data to lead us to where we need to go. So that's kind of our approach. And I also want to mention a few upcoming virtual workshops that we have coming down the line. So we have a Cancer Thriving and Surviving beginning October 6th, Diabetes Self-Management beginning November 8th, and Chronic Pain Self-Management beginning November 13th. And I want to mention too that any county, like anyone from any county, is welcome to participate in these upcoming workshops, as they are virtual and open to the public. So really, if you have anyone you know is interested, like really turn them over, because we are looking for participants for these to fill these spots as they are coming down quick. So and all of these virtual workshops are also hosted on the Get Healthy North Country link and the website. So and as Anne Marie and Anne also mentioned, we do have a newsletter that's just started to come out, and we are looking to insert the upcoming workshops within this newsletter as well. So this is just another avenue to access upcoming workshops. But with my point too, we are always looking to have like host and delivery sites for like again, we are looking to the new year. So if anyone is interested in hosting or delivering future workshop, please let me know, as we are looking for both and planning for the new year. So we're striving for like January, February. And this goes for informational sessions as well. So say if you are interested in hosting an informational session, but really not the workshop, that's okay. We are always looking for both. So our goal is really to deliver one informational session a month, but we are striving for more, especially as we are looking to ramp up the virtual workshops with informational sessions as well. So please let me know if this sparks like any interest for anyone in the upcoming months. And again, if you have any questions about the informational sessions, as I know I talk really fast, so or hosting programs, please feel free to reach out to me. I know I see a lot of familiar names, may not be any familiar faces, but I see familiar names. So please feel free to reach out to me. I will place my contact information in the chat for anyone that has additional questions, may not want to ask now, or something, or any interest in hosting workshops or informational sessions. Just please let me know, and I will put my information in the chat. And I will let Amy take over anything that I missed or anything she wants to clarify on.
Hey, Meg, it looks like Ray has his hand up, and there's also a question in the chat for you as well. So,
oh, awesome. Okay, take it away, Ray.
Thank you, Ariana. Meg, let's definitely get together and discuss these informational sessions. I mean, this just so parallels something we're already doing in Franklin County via our Community Friendship Volunteer Program, which is the program we offer that's all about building more age-friendly communities. And we're currently in the process of doing informational sessions at, say, Valley, all the nursing homes, all the facilities up there as a partnership with hospice. So we could definitely work together on doing these informational sessions, extremely hyper targeted at the people you're looking for.
That is amazing. I love it. That's why I was excited for this to get the information out, because I think it's super important. But I will certainly can contact you, Ray. I think I actually have your contact information, but I will put mine in the chat as well. Okay. So you can reach out to me.
Thank you. And we'll get together with Susan Schrader, who coordinates the program for us up there, and we can get this going along. We even have grant funding available to us to help produce these events. So this is just perfect.
Oh, awesome. Thank you. I will definitely be in contact.
Okay.
and the question in the chat, Meg, was actually answered by Anne Marie. So that's all good. And I did drop Meg's email in the chat for anyone who may have more questions.
Oh, thank you, Ariana. Look at you go. Covering me.
No problem.
And I don't have anything else to add at this time. I think you covered it all really great. Thanks, Meg.
Michelle Catlin did say that Claxton Hepburn Medical Center would be interested in hosting a session and would like you to reach out to her.
Will do. I love this. Okay.
Yeah, this is fantastic. Thank you so much, Meg. Great, energetic, engaging presentation. And I don't know about you guys, but that little dog with the little ball, like what's more inviting than that? Come play with me. Aw. All right. Any more questions for Meg? All right, so let's move into partner sharing. There are two partner issues or two partners that I'd like to invite to give everyone an update, starting with the North Country Rural Health Care Collaborative Network grant. And Katie Cook.
Hi, everyone. It's Katie Margison.
Oh my God, Katie, you're right. I'm so sorry.
You're fine. I'm still working on changing it. That's a process in and of itself. But hi, everybody. So AHI was awarded a HRSA grant as of September 1st, and it is called, so there's a lot of different names and acronyms, as we all know, given the space we work in. And Amy and I were talking yesterday about how can we really differentiate the name from like the future consortium we're looking to create. So The name of the grant is a Rural Healthcare Coordination Network Program grant. And the overall goal, actually, I'm just going to pull up something real quick that'll be easier for me to speak to versus like reading text from a notice of award. So this is a 4-year grant, but it's broken up into 1-year chunks, I guess, and the future funding is really contingent upon how we perform in the first year and so on and so forth. I have all the confidence in the world that we will get all 4 years of funding, but you know, just so everyone knows who may or may not eventually be involved in this work, right now the first year is a planning year. The initial funding is for $300,000, and the goal is to establish a chronic disease care coordination network. And the goal of that network is to utilize the chronic disease self-management programs that are already in existence and blend in care management, care coordination, so that there's referrals facilitated from clinical to social care providers in 4 counties. And those counties are Clinton, Essex, Franklin, and Hamilton. This grant is exclusively rural. The focus area of the grant is heart disease. We had to pick from 1 of 5, and heart disease made the most sense because there are underlying factors around diabetes, hypertension, that really blend well into the chronic disease self-management work that has been ongoing. The target population is individuals that are enrolled in Medicare fee-for-service and Medicaid managed care. So there are network partners listed on this grant, and these network partners are going to get together early next week to kick things off and just informally talk about next steps. Adirondack Health Institute, of course, being the lead applicant, and additional partners include the Adirondacks Accountable Care Organization, or ACO, Northwinds IPA, Hudson Headwaters Health Network, North Country Healthy Heart Network, and then Champlain Valley Physicians Hospital and Alside Medical Center. The grant team, in addition to myself as the network director, includes Amy Kohansky at the Heart Network as the project director, and then Kate Pabst, who you heard from at the top of the hour, is the data coordinator. Some of the activities are going to be centered around a bigger focus on care coordination and care management with chronic disease self-management programs. And there are a lot more details than that, but what we really see this being is, for those of you who are familiar with NCCCC, which Mary McLaughlin has been spearheading for the last couple of years, we're seeing this grant as a sort of continuation of that work while bringing in all of the work that this group does around chronic disease self-management into that. And I really think that's going to drive and increase referrals and individuals in those 4 counties getting enrolled in the programs, going through the programs, because the care management focus is now brought into it. And I'll wrap it up with a couple of next steps that Amy and I are working on. Like I said, a virtual kickoff meeting early next week. Her and I and Ann will all be at the AHI Leadership Summit on Wednesday and Thursday. If anybody wants to come talk to us about the grant or being more involved in it. And then, of course, we have some due dates that we're looking at in this planning year. It's really about building infrastructure. And granted, a lot of that infrastructure is already in place. It's putting all those pieces together. So some of the things that we're going to look at doing are a baseline services map to really look at where there are gaps in the area. There have been a lot of mapping exercises already done. So we're going to look at what's already been done to see if we can add to that versus recreating the wheel. We have a network data collection plan that we're going to work on, as well as a 4-year work plan and logic model. I'll let Amy chime in if I missed anything, but I think that covers all the high points.
Gosh, I really don't have anything else to add to that, Katie. That was really great. I think I understand it better now after you explained it like that. It was perfect.
I'm really good at like just flying off the cuff and just coming up with stuff. That's my strong suit.
Yeah, no, you really hit all the points. Thank you.
Great.
That's
so yeah,
great.
If anyone's interested, certainly reach out to Ann, Amy, or myself. And like I said, if you're going to the Leadership Summit, next week down in Lake George. I'd love to chat with people. I'm really excited to see some of you, hopefully for the first time in many years, it feels like, since COVID. So certainly reach out. And we'll of course be communicating as we get really into the work here.
Great. Thank you so much, Katie, and congratulations to AHI for bringing yet another opportunity into the area that will help us, really achieve what we're trying to accomplish here. So it's really great. All right, with the last few minutes that we have, last but not least, I want to turn it over to Shannon Morrison at Glens Falls Hospital to talk quickly about a survey that the New York State Smokers Quit Line is asking CBO or community-based organizations to complete.
Good morning, everyone. I will be brief. I know we're right up against the hour, but for a bit of context for everyone, the New York State Smokers Quit Line is part of the New York State Bureau of Tobacco Control, and they are telephonic, text, and web-based resource for tobacco use disorder. So you as an individual can call in and receive treatment from a certified tobacco treatment specialist, assistance to get help to quit smoking. Traditionally speaking, they partner with health systems, and that's how they get their referrals. If you're not calling as an individual, a provider can refer. Post-COVID, if we're saying post-COVID, they've seen a pretty sharp decline in referrals from health systems. And in their latest procurement, they are going to, in addition to that work that they're going to continue, they're going to partner with CBOs, which is really exciting. And I think what we all who work in tobacco have been saying for some time, that this is a partnership that needs to happen. So as part of their capacity building around that, they have put together a very brief survey for CBOs to sort of see what you're already doing with tobacco, if you are, what you're seeing with your clients or patients around tobacco. So the link is here. It literally takes under 5 minutes, just a few questions. And if you could please fill that out, it would be really helpful as they build their work with community-based organizations.
That's great. Thank you so much, Shannon. And we will send, like I say, the slide deck will come out on Monday. So you'll have the link there. So please do go back. Maybe I'll even call that out in the body of the email with the slide deck that we send out. All right, we're top of the hour. I'm sorry that we're cutting everyone else short. Is there anyone else that had something that they wanted to share with the group before we sign off? All right. Call to action reminders. Just keep helping us get the word out, everyone. Host an information event. We can give you a supply of rack cards or posters that you can be distributing in your areas. Help to promote on social media. All things that you can do. Sign up for a workshop. Learn how to sign someone up for a workshop. And finally, if you're a provider, please be referring your patients to these great opportunities. And Amy Kohansky is here. We should have changed that email address. Amy Kohansky is now the contact person for that. Next meeting, November 10th. And I will not be trying to do this from a location that I'm not familiar with. Thank you all for your patience and sitting through the technical difficulties. And thanks to the team for helping to make this happen. All right. Have a great weekend, everyone.
Thank you.
Thank you.
Bye.
Bye.
Bye.